is I have to start here. So I have to heat it, I have to come to that hammer, heat it again, probably do it 2 or 3 times. I'm gonna make a chili pepper. There's nobody bothering me. I don't look at emails. It allows me to clear my head. When I get to work, I focus on what I'm doing at work because I've already focused away from it. We grew up on a farm in a small canning factory where we made everything and fixed everything ourselves, so you learn how to solve problems.
At the cannery, we started when we were young. We did anything that we could do to help out, and we started out with rather menial jobs. Sometimes it was cleaning out a ditch, or sometimes it was picking tomatoes or hoeing a row of plants, or sometimes it was in the fields moving the irrigation pipes that were moved by hand back in those days.
There were a lot of farms, there were a lot of tomatoes, and it was a warm place with, in my case, parents who valued education and a school that wanted to see you succeed in education. So that's what kind of place it was. But it was also a very hard-working community.
We had to deal with many different personalities and people to run a business. And Dad was a perfect teacher how to do this, and he got along with everyone, and he formed a good team. And that's a much smaller scale than the University of Maryland, but it's the same process.
We used to have TGI Friday parties where they'd have, I guess, a DJ, and all the people at the school would come, you know, all the nursing students, the medical students, all the tech students, and you know, we had anatomy lab together in freshman year, and we started going out. And we married junior year on psychiatry. And he got involved with a really dynamic resident, I guess his senior resident, who was a teacher, Dr. Villanueva, and it just opened the idea of surgery to him as just being wonderful, because he'd always worked with his hands, you know.
I met Dr. Jarrell on March 13th, 1989, when he came into my hospital room to see me before my kidney transplant, to say hello to me. I'm not sure who's more excited to see who. You know, I don't know if we, the patients, are more excited to see the docs, or the doctors are more excited to see us. He's just an incredibly confident man, and always willing to talk with me and answer my questions. My transplant gave me the life that I could have only dreamed of.
So often, as a physician or a surgeon, you see the immediate response or the immediate outcome, but you don't see how it maybe impacted somebody's life.
So as I think back to it, it was in fact 1989. I was a third-year medical student at Jefferson Medical College in Philadelphia. And as a third-year medical student, it was on my surgery rotation at Jefferson that Dr. Jarrell lectured the entire medical school class, but then, very specifically, those of us who were students on a rotation.
To this day, even as president, continues to meet regularly with a small group of students as an educator, because that's the one thing, even as president, he wasn't willing to let go, nor should he, because that's really core to who he is.
Because it's our students, we do everything for our students. There you are.
So from the moments I met Dr. Jarrell, I would say the way I would describe him then is the way I describe him now. He is a gentle, earnest, honest, authentic leader.
I've always had an enormous respect for Bruce because he's a very thoughtful, pragmatic leader, and also very forthright and forthcoming with ideas.
I'd like to welcome you here to the Empower Expo.
We inherited this incredible alliance of the Empowering the State initiative to allow the two institutions to collaborate that would be for the benefit of the citizens of the state of Maryland. We decided that the sequence of grants that we're offering were great, they were doing good work, but we wanted them now to be a bit more strategic. So we want to see initiatives in, neuroscience. We want to see initiatives maybe in pandemic readiness and preparedness. We believe that they should be bigger initiatives that we do together that really have greater impact to our citizens of the state, but also enhance our research reputation nationally, internationally as well.
Man, I don't want to try to win.
Going through the pandemic and going through the last year of the social unrest, the uncertainty in our democracy, the virus, and how it affected, every human being on the planet, I think there's even more of an alliance to do right by people and do right for society in a global sense, in a local sense, in every way we can do, and of course, relative to health inequities.
The hard part comes up now. Now we can keep the infant mortality down. How do we make it so that those infants now blossom, reach their potential, and become great contributors to this city?
He started this conversation, and we started our conversation on this topic with him saying, I need you, even as you're trying to understand what's going on, and even as you're trying to navigate this racial reckoning for yourself, for your family, as a black male, I need you to help me understand what your experience is, what underrepresented minority folks that we serve on this campus, faculty, staff, what their experience. He really wanted to try to understand, and he was clear and honest and earnest in saying, I don't quite understand it all.
And so to be anti-racist is to recognize those disparities, those inequities.
He likes to say, I'm a kid from the Eastern Shore. And so I don't want to pretend that I know what the experience of a black kid in Baltimore is, because I don't, but I want to understand, and I'm willing to talk to anyone who could help me understand that.
Just yesterday, the World Health Organization declared the coronavirus outbreak to be a global pandemic.
Early on in the pandemic, we had expertise here at the University of Maryland, Baltimore, that knew that something historic was coming our way. We didn't know the gravity at that time, but we knew things would potentially change. And I remember briefing him early on with his emergency management colleagues and saying, this is how this event could unfold.
I ask your indulgence, and I ask for your partnership at all levels to get us through this very difficult time.
And the qualities of leadership that Dr. Jarrell demonstrated, what I would say would be three that I really value: decisiveness, collaboration, and diligence. His perseverance, no matter if I called him at 5 o'clock in the morning or 11 o'clock at night, Dr. Jarrell picked up the phone, and his first thing he would say to me, what do you need? How can I help? I can't tell you how many times that I needed to hear those words, and he was the right leader at the right time.
A moment that I will never forget is the first day that Dr. Bruce Jarrell was president. 8 o'clock in the morning, he walks in as a study volunteer to take the Moderna vaccine. And I see that as a powerful example about how he leads by example.
You ready? Little pinch.
It was a very meaningful moment. It had a big impact. I have to say that other presidents of universities followed close behind, and their leadership in accepting this vaccine, putting themselves a little bit at risk because there are always unknowns when you're testing a new vaccine, was such a strong example of powerful leadership. He had the ability to connect us with the right people and make things happen quickly, and that was essential to our success.
We both wake up every day thinking about the citizens of Maryland. And when you think about the role that higher education plays in defining the future healthcare workforce, and when you think about the healthcare delivery system, the truth is there is no light between our two organizations. The way we aligned and made joint decisions during the pandemic, I think represents how we differentiate ourselves. Because while I think the state of Maryland has benefited from many partnerships, I don't know that there's any partnership that is as strong as the partnership between the medical system and the University of Maryland, Baltimore.
Bruce takes the job not because of the title or the position or what the remuneration will be, but he takes it because he wants to have the power and the ability to make a substantial, meaningful change to make it better for everyone. And so I think it's more of a mission than just a job for him.
It's not just work for work's sake. It's passionate about, here's a problem. I know I can do something about that problem. I'm going after that. And I will keep going after that until I've exhausted every possibility or I've solved it. And I think UMB is full of people like that. It's not to say other universities and other businesses aren't. UMB, though, is full of people like that.
One, try and get our chili pepper.